Assalamu alaikum wa rahmatullahi wa barakatuh, and hi to everyone. This is Azzam, Saleh, Abdullah, Al-Naggar. I am from University Science Malaysia, and this is my 4th year, and today I'm going to speak about my presentation, which is about diagnostic of bladder cancer using CT scan. Hi guys, let us to go to my presentation. First of all, we need to know the position of bladder. Here there is some diagram here to show us the position of bladder in our body. As we see here, it's connected to the kidney by uterus, and this organ, which is the bladder, is surrounding muscles. It acts like a bag in our body to storing the urine. Guys, now what is the cancer? Cancer is the disease attacked our body, which means some of the cells in our body, its growth uncontrollable, and that means that the shape of the tissue will change in our body. A bladder cancer is a cancer rising in the lining of the bladder, where the bladder getting some of the number of the layer, where the most exposed to the cancer is the last layer, which is the last lining layer. So typically in this cancer, we can say this kind of cancer is the 5 or the 6 common cancer in the world, and this cancer also is a common in a man more than women. There is a lot of symptoms in this disease, but the most common is the blood in the urine. Blood in the bladder cancer can be a quite red blood or more than this. All this can be depending on the shape of the cancer in the bladder and the stage of it. Also, the bladder cancer. There are many image techniques can be used to detect the blood cancer, such as X-ray or MRI or CT scan or ultrasound. Those all devices can be chosen by the doctor by the situation of the patient, such as if they're a woman pregnant, can be used the MRI or ultrasound. Also, if the child can be used MRI or ultrasound, and the doctor or radiology can be choosing which devices can be used for the situation of the patient. CT scan, one of the devices, can detect the blood cancer, and doctor can see, or radiology can see the shape and the size and the maintaining of this cancer, and know the stage of this cancer if that using the CT scan image. Tomography or CT scan is a device using X-ray ray to crossing section image to the body by thick beams to produce a series image with the different angle around the patient that show us the 3D of the image. Those are a digital image that built together to show us one single image of any area in the body we want to examine. Here is, guys, the picture of the diagnostic of the blood tumor by using CT scan. As we see in this picture, guys, we have the bladder, and we have in the square red one the small tumor in the middle of the bladder. And also in some cases, maybe doctor asked the patient before diagnosis started to not drink water an hour, and also in the other cases maybe asked to drink some liquid that would show the picture more clear, especially if the tumor is small. Bladder tumor have several types, such as the second image shows the flat tumor cancer, as it's referring to the blue line. It shows where is the position of the cancer. So guys, now let us to move to the other side, which is the disadvantage of using CT scan. First of all, the disadvantage of using CT scan, which is CT scan produce the ionization radiation, which is X-ray with heavy beam. That kind of X-ray can affect the tissue and also damage the DNA, or either damage the bones. Secondly, possibility of getting cancer in that area you have diagnosed. And the third one, which is the short side effect of exposure, such as difficulty in the breath, and also scratch in the skin or feeling dizzy. Also in the case of bladder tumor, as we see in the image A and image B, image A showing the small cancer which can be not detected in some cases, and also in image B, if you know, just it's referring by the black line to show us where the tumor is it. In the conclusion, guys, I want to say CT scan play one of the important roles to detect the cancer in the bladder, and also it show a good result, a positive result that will give us the position of the tumor and sizes and also the location of it, and it's one of the protocol using over the world. In the end of this presentation, I hope you guys learned the procedure of diagnosis of the bladder tumor using CT scan, and also I want to thank you for listening for this presentation. Thank you.